involved. This morning, we're joined by Dr. Dana, who is an integrative doctor and holistic healer, to tell us why it's important to really keep this conversation going. Welcome to Great Day, Colorado, Dr. Dana. Happy to have you on.
Thank you for having me.
Absolutely. So let's kick this off with some common misconceptions maybe women or just people in general in our community have about cervical cancer.
Okay, so I'll give you a couple. First is that it only affects older women. Not true. The second is that it's not preventable. It is. And the third is that only people who have had multiple partners can get cervical cancer. So I think those are some good ones to start with. Yeah.
Okay, top ones right there. And we talk about screenings actually a lot on Great Day, Colorado, in a magnitude of ways and sectors. But how important is a screening for cervical cancer year by year?
Well, it's essential, actually, because vaccination alone may not protect you, and this can affect women of all ages. Cervical cancer is a lifelong risk, so screening is essential as far as I'm concerned. Yeah.
And it is 2024. People are creating new resolutions right now, and lifestyle changes should be part of that, right? Do you have any recommendations for women or people out there who can really get ahead of this to avoid cervical cancer?
Yeah, so I think what people don't realize is that HPV is directly related to your immune system. Most people, first of all, it is rampant. We're all exposed, almost all of us are exposed to HPV. Our bodies typically takes care of it if our immune systems are robust and healthy. So lifestyle and diet plays a huge role. So a couple of really quick things. As far as diet, easy, eat more real food, get rid of ultra-processed foods, stress. We now know stress kills. Stress is important, so figure out a way to manage your stress. Supplementation, we're going to talk about supplementation. I think it's super important, especially if you've been diagnosed with HPV on an abnormal Pap screen. And then the last, because I wrote a book on it, and I really believe that before you start on any diet or any lifestyle recommendation, you have to start by learning how to hydrate. Hydration is key anywhere, and the book is called Quench. I'm really proud of it.
Quench. Okay. Hey, write that on your list, everybody. Quench. And how can women protect themselves from HPV or clear it more quickly if they receive that HPV diagnosis? I know you touched on it just a little bit, but if you could elaborate.
Yeah, so let's talk about supplementation. There's one supplement I'm going to talk to you about that actually has human studies backing it up, showing that it helps improve the clearance of HPV faster. That supplement is called AHCC. It's a mixture of medicinal mushrooms, the most widely prescribed supplement in Japan for your immune system and for cancer. Really great supplement. The second is folic acid. What they've shown is that women who are diagnosed with HPV have lower levels of folate in their bodies. So we want to replace that folate by giving a supplement called folic acid, which is basically a B vitamin. That's a simple no-brainer, two easy things to do that I think can really help. And I have to say, almost, more than 90% of my patients who come to see me with a diagnosis of HPV clear their HPV. And right now, the regular medicine community, we don't have anything except a watch and wait. So I don't like that. I like to be proactive in our healthcare. So some of the things that we just talked about, stress, supplements, hydration, are things that we can all do, especially when given that diagnosis.
Yeah, all good information and really simple steps that we can take to, of course, as you had mentioned, clear it. Another question for you: how can men help normalize conversations about women's health and be allies in addressing these often overlooked health challenges for us women?
Well, I think exactly what we're doing, opening this conversation. You have to talk to your partners, but the truth is men are affected by this because they are exposed. They're at risk for certain cancers, esophageal and anal cancers. So it's important that they're a part of this conversation. And I think the key is just opening that conversation. We cannot, especially with our partners. Now, I think just normalizing it, just doing it.
Just doing it. I like it. All right. Well, thank you so much for coming in, Dr. Dana, for giving us, you're a wealth of knowledge. So thank you for giving us all this information. We're going to give you some ways you can actually connect with Dr. Dana right here. Thanks again for coming on. Great day. More information and ways to connect with Dr. Dana Cohen, you can just visit our website, drdanacohen.com or drdanacohen.com/quench. That's actually her book. So check it out right there. We'll have more info on our website, kwgn.com. We'll be back.